Welcome to today's webinar. My name is JoDene Bogart. I'm the Child and Family Services Review Coordinator for the Children's Division. Today I will be introducing Missouri's Program Improvement Plan, which was developed in response to the results of Round 3 of the Child and Family Services Review conducted in July of 2017. The Child and Family Services Review, which will be referred to as the CFSR, is a review in which every state participates through partnership with the federal government. The purposes of the CFSR are to ensure states are in conformity with federal requirements for child welfare, to determine what is actually occurring to children and families as they are engaged in child welfare services, and to help states increase their capacity to help children and families ultimately achieve positive outcomes. The CFSR's focus is to learn how states assure child safety and manage risk, effectively achieve timely permanency for children, and assist families in growing capacity to care for their children's well-being in all areas of life. In addition to case-specific information gathered during the CFSR, systemic issues are reviewed as well. Missouri statewide assessment and stakeholder group interviews were used to help our federal partners determine if the state was found to be in substantial conformity with the requirements. The statewide information system assesses how the state's computer system captures each foster child's demographics, placement location, and permanency goal information. The case review system looks at the state's process for making sure each child has a written case plan and that it is reviewed by the court periodically. The timely filing of termination of parental rights petitions are also captured in this systemic factor. The quality assurance system focuses on how the state is able to identify areas of strength and challenge within child welfare and develop plans to improve as needed. Staff and provider training looks at the quality of initial and ongoing training opportunities for both child welfare staff and for relative and foster parents. Service array and resource development assesses whether or not families in all areas of the state have access to services designed to meet their family's unique needs. Agency responsiveness to the community looks at how Missouri coordinates with other agencies who receive federal funding to most effectively meet families' needs. And the final system factor focuses on the state's efforts to recruit, license, and retain foster and adoptive parents, including ICPC. Missouri was found to be in substantial conformity with statewide information system and agency responsiveness to the community. This review of 65 cases occurred in Missouri during July of 2017. 40 alternative care cases, 23 family-centered service cases, and 2 differential response cases were reviewed. Cases were selected from 3 sites throughout the state: Jackson County, or Kansas City, Jasper County, which is the Joplin area, and St. Charles County. Each case was jointly reviewed by a federal reviewer who brings expertise on federal standards and the review tool, and a state reviewer who brings expertise on state policy and procedures. The final report of Missouri's CFSR was received in January of 2018. While there were areas of strength noted, including placement with sibling, educational well-being, and relative placements, there were also areas for improvement. Our federal partners helped us identify 5 overarching themes, which, if addressed, should positively impact the outcomes for children and families in Missouri. The 5 cross-cutting themes are promoting timely permanency, parent engagement, quality worker with child visitation, quality safety and needs assessment, and strengthening the workforce. Once the results were published, the Children's Division was asked to dive into CFSR data and state-owned data to identify the root cause of each area of concern. We strove to get to the heart of the matter so the Program Improvement Plan, or PIP, could be the most effective. Some steps that were taken. We looked into our data. If we didn't have it readily available, we tried to gather it. We asked for external perspectives. CFSR results were presented to a variety of stakeholder groups, and the cross-cutting themes were mapped with them. We asked what their worries are, what they felt was going well, and what should happen to make improvements. We asked staff. Focus groups with the Supervision Advisory Committee members, as well as groups of workers from every region, were conducted. We asked lots of why questions to try and get to the underlying problem, not just identify the symptom. In various meetings where CFSR results were discussed, elements of the integrated practice model were mentioned as strengths and promising practices. Feedback from CFSR reviewers noted that in cases where signs of safety was used in a skillful way, it was very clear children and parents were engaged in the process and involved in case planning. As strategies for the PIP were discussed, it became clear the Children's Division has set forth a path that, when fully implemented, will lead to positive changes for children and families in Missouri. As we go through the remaining slides, you'll notice pieces of the practice model identified in PIP strategies. Lots of the action steps will not be new, but may require investment or reinvestment in the vision already set forth. The first cross-cutting theme addressed in the PIP is promoting timely permanency. The judicial structure in Missouri is such that the Children's Division can make recommendations regarding custody. Juvenile officers, who are officers of the court, consider recommendations from the Children's Division and ultimately are responsible for filing a petition to the court. Only the court can legally take custody. While these teams work quite efficiently and effectively in certain jurisdictions, there are other areas where communication and role clarity can be improved. In focus groups, workers described a feeling of disempowerment in the courtroom as they feel they are not always treated as an equal party. The filing of termination of parental rights petitions often did not occur in accordance with the Adoption and Safe Families Act guidelines. Paperwork takes a great deal of time to complete, especially with siblings whose information is largely the same, and there is a lack of Division of Legal Services attorneys to file TPR. And in cases with concurrent plans identified, both plans were not consistently and actively pursued. We'll now move into the strategies for improving timely permanency. One of the strategies for improving timely permanency is the Permanency Attorney Initiative. Children's Division permanency attorneys have been hired to represent Children's Division staff in the following areas of the state: Kansas City, St. Louis, the 25th, and the 39th Circuit. Attorneys are employees of the Children's Division and will be able to file motions on the Division's behalf, impacting the lives of children from the petition bringing a child into custody through court actions establishing permanency for children. The attorneys will receive training to become familiar with Children's Division's practice model. Permanency data elements, such as the length of time in custody and timely permanency rates, will be reviewed periodically throughout PIP implementation to become aware of the trends within the identified circuits. Similar to fostering court improvement projects and in judicial engagement teams, which are present in several circuits in Missouri, court technical assistance teams are being introduced to every circuit. Regional convenings have occurred throughout the state, providing opportunities for Children's Division and court partners to meet and discuss roles and responsibilities, the Children's Division practice model, and circuit data. Following the convening, each circuit team was encouraged to develop a plan for ongoing meeting opportunities to continue improvement discussions for their circuit. As the circuits solidify their plans for ongoing communication, in-person technical assistance from Children's Division Central Office will be provided to at least 5 identified circuits. Team decision-making is a nationally recognized best practice which has been implemented in several areas of Missouri. It provides opportunities for the family, agency, service providers, and other members of the Child Safety Network to assess what actions can be taken to keep the child safe in their home or propose the best living arrangements while the safety concerns can be addressed. As circuits have become proficient with holding TDM meetings prior to or upon entry into custody, TDMs have been introduced prior to placement moves in order to increase placement stability. The PIP strategy will expand TDM practice to the 31st and 39th circuits in the Southwest region, the 11th, 20th, and 23rd circuits in the Northeast, and the 24th circuit in the Southeast region. Rapid Permanency Reviews is a case review and process developed by Casely Family Programs to assist child welfare agencies in the identification of barriers and bottlenecks, both at the case level and at the system level, and to help expedite permanency for children in foster care. The population of children reviewed is unique to the needs of each circuit. RPRs have been conducted in several places in Missouri in the last few months. For PIP purposes, RPRs will be conducted in circuits 10, 24, 39, and 46. Review tools are created based on each circuit's procedures. Instead of a traditional case review, there is pre-work to complete the tool as comprehensively as possible. Interviews are then conducted with the assigned worker and/or supervisor to identify the bottlenecks which are impeding permanency for the child and to develop follow-up steps with time frames for completion. Following the RPR, a cadence of accountability is put in place to ensure the follow-up steps occur. Similar to the CQI process, if system bottlenecks are not able to be resolved at the circuit level, concerns can progress to the regional or state level as needed. The next cross-cutting theme is parent engagement. In reviewing the data and considering the information gathered in focus groups with supervisors and workers, several areas were noted which can negatively impact parent engagement. Staff turnover can make it difficult for parents to re-engage with a newly assigned worker. Parents may not want to share their story multiple times with multiple people, leading to a decrease in engagement. Workers are concerned with their physical safety as they enter into unknown situations, especially when domestic violence or substance use are present in the family. More strategies to address these concerns will be discussed in the Strengthening Workforce Strategies of the PIP. The Children's Division currently does not have strong mechanisms to hear concerns from parents on a systemic level, and staff expressed a potential lack of urgency in working with fathers, especially if the mother is the primary caregiver and actively working the case plan. The first strategy to address parent engagement is the development of parent cafes. Parent cafes provide parents a space for conversation and collaboration. They focus on engaging parents, developing parenting communities where common experiences and concerns can be discussed, and promote peer-to-peer learning. Participants who have been involved with parent cafes have expressed feeling encouraged, inspired, and empowered. There was also an increased sense of social support as well as concrete supports. Throughout PIP implementation, parent cafes will be established and implemented in at least one circuit per region. Similar to the State Youth Advisory Board and Foster Parent Advisory Board, the Children's Division will be developing an advisory board for biological parents. We don't have a strong mechanism for hearing from parents and for receiving input on policies and procedures which directly impact them. Creation of the Parent Advisory Board will model the importance of parent engagement from the statewide level to the case level. The non-resident or non-custodial parent is often overlooked as an important safety and well-being resource for children, especially in family-centered services cases. Families are encouraged to engage the non-resident parent as appropriate when it is in the best interest of the children. Direction was solicited from the Division of Legal Services regarding contact the Children's Division is allowed to pursue. Staff are able to contact non-resident parents without the permission of the primary parent. Formal direction will be forthcoming during PIP implementation around engagement expectations of non-resident parents. Enhanced supervisory consultations will support more critical thinking skills around parent engagement and work with staff around when it is safe and appropriate to engage a non-resident parent. The frequency and quality of visitation between workers and parents was identified as an area needing improvement during the CFSR. In cases when signs of safety mapping was skillfully used, the reviewers noted it was clear the parents were involved in case planning, their perspective was evident, and the quality of the visit could be assessed. The third cross-cutting theme is quality worker visits with children. Feedback from focus groups with staff indicated parents and foster parents might not understand the importance of workers having individual time alone with the child. Especially in FCS cases, requesting time alone with the child can shift the tone of a home visit from support of the entire family. Staff expressed difficulties in building relationships with children of all ages. Some may work well with young children, but may not be as comfortable engaging with an adolescent. Staff turnover was also mentioned as a barrier to child engagement. As workers change, the child may be hesitant to reinvest in yet another relationship. Similar to engagement with parents, signs of safety mapping tools, when skillfully used, are helpful in capturing the child's voice and perspective. The variety of tools provided in the framework can be tailored to help staff engage with children of all ages and developmental levels. Training will be developed and provided to reinforce the importance of worker visitation with children and include the reason for a private time with all children served. Frontline supervisors are critical to the work of the Children's Division. Additional support for supervisory consultations will be developed to encourage critical thinking with staff. Policy will be introduced which will require supervisors to observe at least one worker with child interaction per quarter per worker to assess the worker's engagement strategies with children. Coaching supports through workshops and coaching calls will be provided to circuit managers who may have had limited exposure to the Signs of Safety practice model consultants. Coaching will focus on how they can support staff using the practice model within their leadership role. The fourth cross-cutting theme is quality, safety, and needs assessment. Feedback from supervisor and worker focus groups expressed confusion about how and when to complete safety risk assessments and how to document those assessments in phases. They requested policy guidance on the use of Signs of Safety assessment tools, the frequency of use, as well as documentation expectations were mentioned. Because of the unpredictable behavior associated with mental illness and substance use, assessing child safety becomes more challenging. Staff reported concerns with their safety as well in these cases. Policy guidance will be forthcoming to incorporate practice model frameworks into the Child Welfare Manual. Specific instruction on the Signs of Safety Family Assessment Map and safety planning tools will be provided to staff and reinforced through learning circles within each circuit. Later in the PIP implementation period, the Family Assessment Map and safety planning tools will be included in the FACES system. Previously, in the Quality Worker with Child Visitation section, it was stated that frontline supervisors are critical to the work of the Children's Division. Similarly, supervisors are instrumental in supporting staff as they complete quality, safety, and needs assessments. Tools to improve supervisory consultation and support more critical thinking skills will be introduced. In addition, circuit managers will be provided opportunity for coaching calls with practice model consultants. The Children's Division is partnering with the Department of Mental Health to expand the Assertive Community Treatment Team program to serve pregnant and postpartum mothers who have co-occurring substance use disorder and mental illness. The expansion will occur in Greene County in the southwest region of the state and will be available to families who are at risk of child abuse and neglect or who are currently involved with the Children's Division. The program will provide direct services in the home. A multidisciplinary team is available to help address the unique needs of each family. The last cross-cutting theme is strengthening the workforce. Staff reported initial training is not comprehensive and expressed a need for additional on-the-job training. As new supervisors have promoted, they may have missed out on the training provided by the practice model consultants. Filling the gap for these supervisors as they try to train and coach staff is an area of need. In other areas of the PIP, concerns of worker safety have been noted as a root cause for lack of engagement with parents, and focus groups commented that newly hired staff are unaware of the complexities of the job they are being hired to perform. This leads to feeling overwhelmed very quickly, and they often leave the agency. Turnover contributes to lack of engagement, which then results in ultimately permanency, among other impacts. During the pause last year to reduce the backlog of overdue investigations, it was powerful to see how dramatic change could occur with support and focus of all Children's Division staff. Field support teams are regionally assigned groups of central office staff designed to support field work in a variety of ways. Through initially building relationships between the field and central office, field support teams can begin to assist regions in practical ways when crises occur or the workload becomes unmanageable within the region. The Children's Division is committed to growing leaders throughout the agency. The National Child Welfare Workforce Institute Leadership Academy has been completed for a number of supervisory staff. During PIP implementation, opportunities for additional staff to work through the year-long academy will be available. Inclusion of high-performance transformational coaching into the Leadership Academy will include the frontline staff of the cohort members. Initial staff training is provided uniquely by each regional training team and the training teams within the contracted foster care case management agencies. Development of a consistent competency-based training program for new staff will occur during PIP implementation. While training teams will have flexibility in presentation, a core set of knowledge and skills necessary to conduct child welfare practice should be infused throughout all initial training packages. Children's Division will be working in partnership with the Department of Mental Health to develop staff safety training, incorporating trauma-informed care and the 5 domains of well-being. It will be a combination of web-based and classroom training and will focus on physical as well as emotional safety as frontline staff encounter unfamiliar and unknown situations in their work with families. Staying Power is an evidence-based model which helps agencies select qualified applicants who are a good fit for child welfare. The model strives to decrease turnover by hiring the right people. Competency-based interview questions look for transferable skills. Applicants are provided a realistic job preview through video and shadowing opportunities so they have a better picture of the work prior to accepting a position with the Children's Division. The Northern Region will be trained on the Staying Power model and process and will begin using the interview structure during PIP implementation. The Program Improvement Plan was approved by our federal partners on October 15, 2018, with an implementation date of November 1. The Children's Division has 8 quarters, or 2 years, to complete all of the key activities for each strategy included in the PIP. Then, an additional year of monitoring occurs to let the completed strategies manifest or be seen in outcome data. Should the Children's Division not be able to complete all activities outlined in the PIP, or not see sufficient improvements in monitoring data, fiscal penalties can be assessed. So we will put forth every effort to ensure the PIP and the included strategies are a success. The Program Improvement Plan in its entirety can be found on the Department of Social Services website at the link listed. Any questions can be directed to me. My contact information is on the screen. Thank you.